Hello, everyone. Welcome to the session today. My name is Jane Grimes, and I am a psychologist, and I work with Spectrum Mental Health, and we're a partner of Laya. So I'm really pleased to be here with you this afternoon. Now, what I would like to suggest just before we get started is just a little bit around how you might get kind of any questions addressed if you've particular concerns that you really want to make sure that we look at today. You can contact me either through raising your hand and I can unmute your mic, or else you're welcome to drop a question into the chat function. So as you prefer, really. And I'm really happy to take questions as we go. We'll also leave a little bit of time towards the end of the session too. So we'll have about 10 minutes or so towards the end. But please feel free, just if your question is particularly pertinent, jump in. I'm really happy to take any comments and thoughts along the way. So welcome to the session, everyone. I'm going to just give you an overview now as to what we're going to look at. So for many people, we're starting to move back into office environments and starting to move out of maybe what has been a more reliable social kind of space. So we're moving into a very kind of different model of working. For many organizations, they're adopting a hybrid model, which is blending working from home and also returning into the office in some capacity. So we've got a situation where a lot of things that might have been in our control are now a little bit less as we step into the organizational environment again. So we look at some of those old rules and new rules and how things are changing. And sorry, somebody has just mentioned that they can't hear. So I think maybe somebody else might just drop in a quick thumbs up to me, just a quick confirmation that anyone else can hear, just so I know that it's not a problem on my side. If I could ask maybe Ronya, if you're there, maybe you might just confirm. Great, thank you very much. Lovely. So I think there's a bit of detail there around how you might work out the mic. Fab, thanks a million others for letting me know. That's really helpful. Yes, so we'll look at, within the context of those first 2 points, I want to look with you around implications for our mental health. And what we know from research looking across various different groups who have had to self-isolate for various reasons, we have a little bit of an idea what to expect in terms of implications on our mental health. So really all of the content today is situated within that context as well. And we'll look at strategies then for returning to the workplace. So I'm going to start thinking about the physical landscape of a return to work. So before we start to look at individuals, let's look at what we're going back into. So objectively, kind of how things are going to look is going to be quite different. And, I think we've really all got quite used to this. But, depending on whether your role involves a lot of client interaction, or whether your role involves a lot of interaction physically, there's a lot more. There's a lot more things in place to protect us now. So maybe in your office, you're walking into an environment now that's going to involve plastic screens. Maybe there's going to, and very likely there's going to be hand gel at all the touch points along the way. Maybe there will be one-way systems where maybe there will be a lot less freedom around how you move around the buildings. We'll have very different seating arrangements. So we will have offices where there will be a maximum number of people where we'll have to maintain a distance from each other in terms of we're physically sitting. Meaning that there's going to be a lot less interaction socially, as we no longer maybe are so easily able to turn around and talk to a colleague beside us, but maybe that casual conversation now is one that's across a room. So it's going to have an impact on social cohesion within our workplace. There's going to be policies where previously there weren't any. So maybe how we book rooms, maybe scheduling will be a lot more proactive, where maybe we could arrange things very last minute. We're going to have to be much more organised. Even things like elevator use. There's going to be a lot of restrictions around the number of people that can be in an elevator at the same time. Maybe there will be new policies that we've got to introduce on taking deliveries from non-staff, so people who are maybe delivering office supplies or food. There's a lot more steps in place. And the big impact, obviously, is going to be on our time. There's going to be a lot more of our time is going to be taken up in planning to ensure that we are sticking with all safety measures. And we've also got to look at how we manage communication, how we manage projects across not just people who are now returning to the office, but obviously for many of us who will continue to work from home, how we can ensure as managers, as colleagues, that we're equally involving people who are home-based or who are office-based, or maybe some kind of blend of the two. We will be seeing, in many cases, a staggered return to full capacity. We will be operating in many cases with specific pods of people who might work together and possibly work in a separated way from others in the team. So things are going to look and feel very different, and maybe they already do. And I would really welcome if you want to share a little bit around what's happened for you in your return to your department, to your teams at the moment. That would be really interesting to hear, what you've noticed so far, or what you, if you're a manager, what you're introducing up until now as well. And do you have questions around it? Are you wondering around whether or not you're covering everything, whether you're kind of ticking all the boxes at the moment? Bearing in mind that all of this is, something that we're all very new to. So actually it can be really helpful, and I'd certainly welcome it within this context to throw in questions that you might have, because I'm sure that there's others who are grappling with exactly the same things. So returning to work, it's likely to mean very different things to different people. And as you can imagine, and as I'm sure you know from talking with colleagues, everyone's experience here has been very unique. So depending on what people's home situations are like, dependent on the level of responsibilities that people have at home and have been having to juggle with their working life, actually coming back to work for some people could be a real relief. If maybe it means that now the focus is on what we're doing at work rather than having to juggle everything, then it might feel like actually some of the weight is off our shoulders. However, for others coming back in, it may be that actually this presents a real elevation of risk. Maybe you're in a vulnerable group health-wise, or maybe you're living with people who are vulnerable, who are maybe an older population, or people who have pre-existing health conditions. Actually, coming back to work can present a real range of emotions. And I say this because we're likely to see, as people begin to come back, we're likely to see an elevation of some of the level of anxiety that was quite strong for people in the first few weeks of lockdown, when there was huge ambiguities and uncertainties. So it may feel as though we're moving forward to some degree, but actually this shift is really likely to provoke a lot of questions for people. And really there's that kind of absolute conflict between what for many people has been an increasing desire to need to connect to other people, but also that risk that comes with that. And we are, at a fundamental level, we're geared to survival. And if we're already aware of a risk, and a risk that is, made even more anxiety provoking by its invisibility, then everything around us that is a new introduction to our environment, any, people maybe who we don't know very well, we've maybe got a very different approach to risk and management of risk, we're likely to quite naturally be assessing kind of anything novel as a potential danger. And this is, fundamentally, a part of what it is to be human. We're fundamentally wired to try to survive. So what can happen is that we very quickly can move into a very threat sensitive mode. So you'll have come across the idea of fight or flight. So really the idea that when our anxiety has got to be enough to propel us to act and propel us to make changes in our environment to stay safe. So anxiety is a very natural emotion for us to see when people are coming back into the office. And that anxiety we can start to tackle that in a number of ways, which we'll talk about as we go. And we know that over this last 6 months that we have all been adapting to social distancing and all been trying to accommodate our day-to-day practices to make that a reality. And for many of us, that has come at a big cost in terms of social relationships, or maybe, different aspects of our life, but an absolute necessary cost, in order to maintain our safety. Now we're being asked to reverse this. Now we're being, as restrictions have lessened, in the main, we've now been encouraged to start to return back to normal. And for many of us, this can present a real conflict. And I want to say a little bit here about potential reactions to these changes. So certainly in the short term, though, many of us experienced a real increase in anxiety, a real increase in irritability, changes in our mood, really, really common reactions to the huge amount of uncertainty that we've all been experiencing. And I want to really flag that a lot of these initial reactions are likely to be quite visible again. And I think, just to bear in mind that this social aspect is so important. One of the biggest risk factors that we know of for mental health conditions is actually social support, or lack of it in this case. We know that social isolation and loneliness actually have got very significant links with the development of depression, the development of some anxiety conditions, and also to the development of longer-term physical health conditions. And there's been a lot of research that's looked at long-term isolation, particularly, and long-term loneliness with these health conditions. Now, I want to make the point here that this is kind of very long-term experiences that have been found to lead to changes in people's physical health. So this is, for people who, particularly in elderly populations, where there's already some predisposition or health vulnerabilities there. But I want to say this because we have all been spending probably a lot less time with people who we're close to. We've all already, having gone through what we've gone through already, we are at a slightly elevated risk for common mental health changes such as anxiety or low mood. Now, particularly this is the case, that this impact of reduced social support, particularly we know that this has a link to changing mental health status in people who've got pre-existing mental health conditions. So for people who maybe have experienced depression, for example, or recurrent bouts of depression, or for many people who may experience elevated anxiety already pre-COVID, we know that actually the prolonged social distancing can be a big factor in actually in a deterioration. So I want to emphasize that actually coming back into work is likely for many people to be a really positive change to their lives, particularly if there are pre-existing health conditions there or pre-existing mental health conditions. But we want to make sure that this happens in a safe way and in a way that's reassuring rather than even more anxiety provoking for people. So I'm going to stay with this a little bit. So these changes that we see in many people in relation to things like changes in mood, things like changes in irritability level, or changes in level of maybe anger or frustration that we might experience, these changes, I certainly, I work with many people doing therapy, so one-to-one support, and the majority of people who I'm working with at the moment, over the last number of months have said that they've experienced changes to their mood. All the research backs this up as well. So there's been a lot of research that's been published. For example, The Lancet have produced some really interesting, they've collated a lot of different research looking at the mental health implications of social distancing and social isolation, looking at previous epidemics such as SARS or Ebola. And what they found is that the majority of people reported changes to their mood in as quick as 10 days into social isolation or quarantine. So in such a short amount of time, we can start to notice a difference in our mood. Now, the good news is that for most people, these changes don't last in the long term. So what we know from research following up on people who have had longer periods of self-isolation is that actually in a maximum of 4 to 6 months, most people have returned back to their normal mood and their normal mental health status. Most of us return to that, no matter kind of how elevated our experience of anxiety has been. But it's very, very common for that transition to take a little bit of time. So I want to just talk a little bit around things to look out for here, and things to look out for in colleagues, things to look out for in yourself, that that transition might be impacting upon you still. And really I want to kind of emphasize the notion of change and change on a general level. We might see that somebody's interest in maybe connecting socially seems to have changed over lockdown. Maybe we're noticing with colleagues, maybe they're starting to turn off their videos more than before, and maybe they're not attending meetings as reliably as before. The question, first of all, to ask is, is this consistent with what you know about people's personality in the first place? Because actually for many people, many people have said, with this experience of a lot of our communication being online, people have said, actually, I really don't enjoy communicating with people online. I way prefer to pick up the phone and have a conversation, without having to be faced with people directly, on video conferencing. So for many people, actually, there's been a sense of a bit of a reprieve from having to kind of step in and behave in a certain way around social obligations. So I really want to highlight that this idea of change in relation to change to people's preferences, change to people's normal behavior. So looking out for things like changes to people's motivation, changes to interest in particular projects, or changes in people's interests and things that they're doing outside of work. Are people talking about, or are you noticing in yourself changes to your sleeping? Or is it more difficult for you to get asleep at night, for example? Or are you finding it very difficult to stay asleep once you're asleep? So sleep is one of the very first kind of, in a way, the kind of like one of the first kind of small little little signals to us that actually kind of something might be amiss. So checking in with your own sleep, checking in with colleagues, how colleagues, like really keeping your ears open if you're hearing people mention changes to sleeping routines, changes to people's appetite and eating routines, changes to people's exercise or general activity routines. So I'd really encourage you, reach out to others who you're working with, looking as we look to move back into the office, looking to try and sustain and streamline communications that you have with people, so that in the way that you'll check in with people who you'll see face to face, also try and check in with people who are still working at home, and check in informal ways as well as formal ways. I think, having worked in the area of kind of mental health and organizational mental health for a long time, I think we're probably, I don't think I've ever in many years seen such a change in how we're talking about mental health, and such a change in our openness in talking about our mental health. And I think the fact that we've all been sharing a relatively similar experience and a relatively consistent stressor has actually created something of a level kind of playing field, a similar starting point in a way that, you know, we've just not experienced before. And I really, really encourage you, use this leveling experience to try and reach out to people who you're working with. And one way to begin to do this is, you know, around actually talking about your own experience. Let people know if you're having a tough time. Let people know what you've noticed has helped or potentially hindered your mood on any given day. Let people know what kind of things you might be dealing with outside of the office, you know, or outside of your office space. If there are stresses, you know, that are kind of in the room next door, you know, maybe you're dealing with, maybe there's childcare, maybe there's other pressures. I would really encourage you, as much as you're comfortable with, share some of that. It is one of the most reassuring things that another person can hear. And it is one of the most obstacle breaking things that we can do to encourage people to talk about how they're doing if they are struggling. One of the things that really prevents people from talking about this kind of stuff is that perception of there being some kind of stigma around this. And actually, you know, I really want to emphasize, if somebody is struggling, if they can begin to speak about it and can begin to say a little bit about it, they're much more likely to get to the right kind of support and actually much more likely to get back to their old selves much more quickly. And I say that, you know, with research we have around things like low mood, for example, you know, if someone is experiencing depression, somebody passes about the first 4 months of experiencing depression, you know, if their depression is lasting that amount of time, what we know is if people don't reach out within the first 4 months or so and don't kind of link up with the right kind of care, actually we know that in the longer term, people can struggle with their mood for up to about a year and a half. So the research in terms of looking at occupational mental health tells us that if we can get people connected to the right support as quickly as possible, actually we get them back to their old selves and back into work much more quickly. So I really emphasize this because I think it's really important to try and talk about this stuff. And even if it feels a little bit kind of ham-fisted in the beginning, even if it feels like we're kind of not sure that we're kind of saying or doing the right thing, I would always encourage you to start with yourself, you know, share your own experience. And short-term changes, which I've mentioned, also let's look at things like people, like I've talked about, people being less motivated, or maybe people, you know, not attending meetings as much as we might have seen in the past. Also keep your eye out for people who appear to be working very long hours. Particularly if people seem to be, you know, working much longer hours than normal. I would really, really, really help people to see the value of keeping routines which involve both working life and also home life and things outside of work. And particularly if you've got colleagues who maybe people are living on their own, or maybe people are living with maybe housemates who they don't know so well. And so maybe they're feeling quite isolated. Maybe people are feeling quite lonely and are throwing themselves into work as a way to kind of escape from that. And also, you know, for some people, if they're experiencing elevated anxiety, actually it can become redirected, and people can throw themselves into work as a way to, again, kind of like move their attention away from their anxiety. And it's very, very common, you know, for many of us to do that. So I would really just always be open around the kind of conversations you're having with people. You know, understand what's happened for people, understand what kind of working hours people are doing. And for yourself, you know, if you're here and listening to this, you know, to consider your own behavior at the moment, really just asking yourself, you know, what changes do I notice, if any, around my mood, around my behavior, around the way I'm thinking about things, around my physical health. And are there, for example, and physically, things like maybe increased headaches, stomach problems like IBS, for example. Maybe you're noticing repeated strains, maybe tension around your neck or your shoulders, or around headaches. We often somatize, so we make physical our psychological state. So do you find yourself kind of worrying around your health in a way that you didn't before? Do you find yourself kind of visiting the doctor maybe more than you did before? So really just noticing any changes in your own behaviour, and keeping an eye on people who you live with. Because often we ourselves are the last to notice changes in our behaviour, but it can be people who we live with who actually know us quite well, who might, given half a chance, tell us exactly what they think of our mood at the moment. So these are things in the short term to really look out for. And kind of COVID specific now, I would really encourage you, if you're concerned that somebody might be struggling a little bit longer term, as the months go by, as we move into September, October, just looking out at people's level of contact with others. You might see people maybe avoiding wanting to come into the office. You might notice people maybe avoiding wanting to, if you work on client sites, for example, maybe avoiding wanting to go out to a client site. Or maybe people coming back into work, but actually, shown increased concerns around their physical health. And, with that kind of increased attendance at doctors, or, maybe more erratic kind of periods of absence. So I would really encourage you, just to kind of stay connected with people. And I'm thinking of particular kind of anxieties that can be really affected by COVID. Like certainly there's a big increase reported in symptoms of OCD, so obsessive compulsive disorder, and which is very much an anxiety related issue. And not surprisingly, as there's so much more media attention on things like virus transfer. So OCD, one particular kind of OCD, is very focused on the risk of contamination. And, as a way to manage anxiety, as somebody suffering from OCD, and particularly a contamination-based OCD, is likely to increase, very dramatically the amount that they may be washing their hands. So we're all likely to be doing this a lot more at the moment. But, really, looking in the months ahead, and really kind of noticing for yourselves, like, is this something that's really elevated for me or for others who might live with? And talking about this stuff, I think is really important. So kind of like big message here is that for the majority of people, in as short as about 10 days, we know that there's some increases in anxiety, in irritability, changes in mood, and that there can be, kind of behavioural changes such as social withdrawal that actually can, in and of themselves, have an impact upon our mental health. Now I want to talk a little bit around kind of the social contract and the change to our social contract. So at the moment, I think we're in a really interesting phase where social distancing rules are easing. And with that, there is now less clarity than there was before around kind of the rules and around how we should kind of engage with each other in a safe and healthy way. So in that vacuum, in comes our individual differences. So the level that I am willing to go to and that I do, kind of without question go to, I'd be very different to the level of, the level of kind of risk management that somebody else might go to. And so I think this is a big thing about returning back to work, that there's going to be differences around this and how we manage them. So like on a very kind of like immediate level, what do I expect of others? Do I expect everyone's going to wear masks back in the office? Are we all going to wear masks in shared public spaces? Do I plan on and do I expect that others are going to use hand gel when using common touch points? Do we bring our own hand gel? Will there be kind of will there be provision of hand gel around us, and across the office? What do we do if others aren't adhering? to the standards that we're kind of expecting people will be adherent to. How do we respond? What do we do in that case? I'm going to just check in now and see if we've any questions. So the question there, maybe question there around Chief Medical Officer has asked us to reduce contacts, and how do you balance this with mental health? Maybe I'd say a little bit more there, because I think that is a really, if I understand it right, but I'm guessing we're talking here about kind of the social implications of this. And so if that's the case, what I would certainly say is maintaining social connections in some way or other is the critical bit here. So it may be that some of those social connections need to go back to, in some cases, not being kind of in person, but actually going back into, some of the routines that we were probably having to pick up when we were at a much more restricted phase. So, looking at people, in your own kind of social network, looking at, who are the people who feel to me like they really kind of, really change my mood when I talk to them, like in a positive way. Who are the people who I feel really relaxed when I speak to? So thinking around, who are the essential people for me that really kind of keep me feeling good, and looking at, even if necessary, kind of like having in mind an idea of a schedule at which you can connect in with people. So if I know that there's 3 or 4 people who really have a positive impact on my mood, actually having in mind I'm going to talk to these 3 or 4 people, once every week, once every 2 weeks. So that there's a reliability of social contact that's there for you. And it's, again, just to kind of talk about, what many of us might be experiencing, maybe already, what if I feel safe through others' behavior? What if I'm adhering to all the guidelines here, but what if others might not be? So in the workplace, we're probably going to see some, anger and frustration, as that kind of anxiety is elevated, and it comes out, in very natural ways and very different ways for different people. As we shift from moving into, and I guess shift from, what I would call a safety culture. So where the emphasis is very much on following the guidelines in order to maintain our own safety of others. Over time, we're going to feel that contrast potentially with kind of the organizational culture that we know very well. As we're more comfortable with people, as we've seen people more regularly once we're back in the office, actually, it can be very easy for our guards to begin to slip as we slip back into kind of very old familiar kind of places. So really, I'd emphasize here the importance of maintaining that sense of doing of following guidelines, for not just for ourselves but for others as well. And there's a lot of the messaging, in terms of public health messaging, has been very much around this as well. So if we ourselves don't maybe judge that the risk to ourselves is so high, actually we're acting for those for whom the risk is higher. So what do I need to do to ensure that another person feels comfortable, and that other person, with whatever links to maybe more vulnerable people that might be there for them? And over-communication is really important here. And over-communication could be around how we're going about some really kind of basic things, where we're going to be sharing spaces with other people. So thinking a bit more around that. Some people have been asking me, kind of how can I communicate? If I'm really uncomfortable with someone else's behaviour, like what can I do around this? And we've talked about, well, we can try and kind of step away from some social situations. We can try and remove ourselves. We can create the space between ourselves and other people. Actually, there can be some really, really quite uncomfortable situations where actually maybe we are very close to somebody physically, like such as in a lift, for example, where, you know, for a small amount of time, we actually don't really have too much room for maneuver. So we're very reliant on others to respect space as much as we're doing so. So I just have put together just one example of a way that we can address this. So I think, you know, I mentioned over communication, and with that in mind, I think it's, you know, it's very helpful, I think, to kind of in some ways state the obvious here, you know, actually to draw our attention again to the fact that this is quite a weird kind of setup, particularly, you know, when you're back in the office, you know, and that very kind of visible difference that we're going to see. So, you know, even beginning by recognizing that, you know, that this is weird, you know, so it's strange seeing all the guidelines in the office. I wonder if I could ask you something. And then bringing people's attention gently to the guidelines, you know, so I'm a little worried we're putting each other at risk. I might be being overly cautious, but I wonder, is it possible we can follow social distancing for now? And it can be helpful to observe the impact that another person's behaviour is having, you know, and I'm concerned about potential risk to each other and any vulnerable people connected to us both. And actually with that saying, and it's making me feel uncomfortable, or it's making me feel quite anxious, you know, I'm feeling quite fearful. So actually talking about the impact on our own emotional state. And really, we really appeal to the other person's altruism and empathy there, and asking for what we need. So can I please ask that you remain behind the line until I finish paying for my coffee? You know, and I really appreciate the effort you're going to. So it might seem, you know, a little bit kind of a number of steps there, but I think in a way what it allows is that it immediately brings us all together into the same the same kind of potential exposure to risk, and it names that. So we're not only talking about our own needs, but actually we're very much verbalizing the shared needs and shared concerns that we all have here. I wonder, I'm curious, how have you found this, you know, for people who've been back in the office, or people who, you know, who you're kind of, you know, maybe in kind of supermarkets, maybe in shared spaces, maybe you've had to address this. Maybe you've, you know, been on public transport and you've had to say something to somebody. How has that been? How have people got on? What have they found goes well? What have people found has been kind of a really effective way to address this with people? Has somebody maybe approached you about any of this? How have they done it? That feels like it's done in a way that feels like it's sharing a concern rather than blaming. Yeah, if anybody has any thoughts on that, I'd be really interested. How are you feeling about addressing these things, you know, when you go back in the office? So yeah, if you want to jump in, let me know. I'd love to hear. So we'll look at now a little bit on some of the challenges of adapting to things. You know, the social norms have very much changed. It's not the first time it's happened. I was looking at something there recently. Apparently in the 15th century, Henry VI actually banned kissing. So at that point, he had said it wasn't allowed, and this was so that because he felt that this was kind of one of the ways that the spread of the plague could be stopped in its tracks. So there's been plenty of instances in our history where adapting and maintaining each other's safety actually has involved really big changes to our behaviour. So our social norms really have changed, you know, and for how long, we don't know. But there's certainly, you know, that sense, you know, many people kind of talk about kind of this having to kind of be our normal. So with that in mind, we've got to look at how we're planning for people who are in multiple locations, people who maybe will be available physically in the office, and then maybe for extended periods of time, you know, are going to work from home and are going to have that mixed model that we talked about before. So we've got to plan for all eventualities, and for all eventualities, for all planning to be running in parallel. So as we're moving back into the office, many of us are looking at how we can go back to some of the older systems for communicating. So, kind of instant messaging, or, platforms that are available both on site, but also home-based. And what this is going to mean at the very least is that there's going to be a need for multiple levels of communication. And I would really encourage that you look at communicating or communication channels that allow for information to both go out to people wherever they may be, but also that people have ways that they can communicate back into supervisors, but also how people can communicate together with each other, and how that communication can continue wherever people are. There's going to be more competition for things like communal space, for shared meeting rooms, potentially, particularly at the beginning as we return, for hardware. So, maybe people have actually now maybe people don't have sufficient hardware for some of the communication channels now that need to be used. So bearing in mind that, there's a need for advanced planning, as we talked about before, but also, prepare for the very natural emotional responses to this. There is likely to be more frustration, more anger, less tolerance for people's needs on the surface. But I, want to remind you that all of this is coming from a place of anxiety and potential kind of perception of risk and the fear that comes with that. So really kind of naming it, I think, is really important here. And we need more time, to plan around a lot of this. We need more time in the office to plan around this. And so really kind of looking as much as you can at your scheduling to ensure that you've got the time to have to plan for these kind of extra steps that are going to be in place. And I want to give kind of a real kind of like just recognition for the challenges of starting in a new role. So for people maybe who have started a job in the company in the last 6 months, it can be, a real challenge. Majority of things that we learn about what it's like to work here are through observation, through sitting alongside people, through hearing others' conversations. And we pick up so much in that way. And there's been, such a gap in the things, in the experiences that people can learn from if you're new to an organisation and working from home. So I would always, really, really say reach out a lot more than you might do, with other colleagues, to those who are newer. Set up buddy systems for new people. If you can pair people up with a partner, with a buddy who will reach out to them and make this a regular thing. So for people's first couple of months in a new role, I would really encourage, have that buddy in place for at least the first 2 months. Have them reach out once a week. Have them reach out to be available to look at both more formal kind of questions that people could have, but also the informal stuff. This is kind of how we do things. When we are back in the office, this was how things worked. So really keep thinking around what it is that people learn when they're simply sitting alongside each other, and how can we translate that potentially into an induction process, or potentially into a more informal buddy system that you might organise. So in advance of returning to the office, there's going to be, kind of like putting down some old routines and picking up some of the old kind of office routines. And so what this might look like is a staggered return potentially to the office, where people return in smaller pods, for example, and gradually building up to bring more people back in. We've talked a little bit about some of these as well. So in the office, so things I will just add is keep an eye on any introduction of any new policies and developments since people have been working from home. Check with your HR departments if there are new policies that have been developed, particularly for coming back into work, and particularly COVID related. if you're involved in actually designing these, communicate them widely, you know, have them available on the internet and accessible to everybody, and let everybody know that they're there. Over communicate, you know, any potential changes to plans, communicate regularly, and keep an eye on how people are doing, and not just kind of eyes and ears, but actually ask people how they're doing. And as I said to you before, sharing your own experience. I think there's you know, that idea, I sometimes think of it almost like kind of dropping crumbs, you know, in mentioning how I've been doing. I put down the idea that actually we can talk about this stuff. People might not be very quick to come in and say that they're having a tough time if they're struggling, but they'll be a lot more likely if they know that they're not the only one. And consider potential for unintended exclusion. And particularly, I think this is where I'd really emphasize looking at any kind of systems and channels of communication to make sure that that communication comes from both people on the ground and from people in senior positions. Create, if you can, forums where people can talk about how they're doing. That doesn't necessarily involve managers or supervisors. Create space where people can check in on each other. Create space where people can informally have, you know, no obligation meetings. You know, certainly a lot of companies have found it really helpful to create, you know, virtual coffees, where people can join as and when they like, and have some of those spaces be spaces on a slightly more kind of formal level, where you might say we want to gather feedback. And have some of that feedback gathering happen where there aren't managers, and then maybe where there are managers involved. So you give people the autonomy and the freedom to be able to have some control over their communication, but also people can together highlight what's important, and people can have some control around how their work is structured. So give people space to talk and to come back to you with specific asks or demands around what they'd like to change, what would help them to be more comfortable in working from home. And that's particularly thinking of working from home, but also kind of asking people what they think is the best way for people to return into the office. So yeah, giving people that sense of control over how they respond to the demands of the job is another really, really big factor in mitigating against any deterioration in people's mental health. And mitigating against stress, really important. So in summary then, so there's a lot of new policies and practices in place, and it may feel like there's a lot to kind of stay up to date with. So as much as you can, I'd say, you know, try and keep up to date, but potentially, you know, this is where creating a group forum can really help, because actually what can happen then is people can bring any updates to the group, and can discuss the implications, the impact, and really kind of bring them to life for people. People are going to feel very differently about this return. Bear in mind, people are going to be equally likely to be feeling relieved as many others are going to be likely to be feeling a real kind of elevated sense of worry and anxiety. And we have so many different ways of showing this. So yeah, kind of one person's uber excitement and maybe kind of throwing themselves into work could be the sign of another person's anxiety and worry. So really kind of noticing changes in yourself and others, and asking around them. You know, I noticed that you haven't been putting on your video in meetings so often. I was wondering, you know, kind of if everything is okay. I noticed that you've been later coming along to meetings, and I know before you used to be kind of really kind of attend early. Is everything okay? And communicate around people's home and work needs. And again, if you share this yourself, it is one of the most reassuring ways that you're going to encourage other people to share the same. If people are talking around some of the challenges that they might have, it's so much easier to then be able to ask them, you know, how can I support you? What is it that you need from me, or what is it that you need from us? I can help you with that. How long do you need? Maybe they say they need some kind of an accommodation to working hours. Great, let's look and see if we can do that, and how long do you need that for? So we're not creating an open-ended change to things, but we're saying that this is in recognition of what's a challenge now, but there's a time limit on it, and we'll review after that and see if the need continues. So yeah, really kind of work to try and accommodate people's responsibilities at the moment. It's really, really helpful to ensure that people stay well over the long run. And make explicit needs and actions in consideration of other safety. And yeah, really kind of over communicate around this.